My name is Mohammed Hussain. I'm a Senior GI Specialist Registrar at University College London Hospital, and this is a case performed by Dr. Rayhan Haidri using the first CE-marked AI device for the detection of early cancer in the esophagus real-time in endoscopy, produced by ONM Vision in collaboration with scientists from UCL. It's a case of a gentleman with multifocal high-grade dysplasia detected on biopsy in Barrett's esophagus. And here the endoscopist is assessing this area using iScan-1 Pentax imaging, which has the added advantage over white light in enhancing surface architecture and improving detection. And we had already assessed using optical enhancement, and there was multifocal areas of concern and abnormality associated with early cancer and dysplasia. So let's see if the AI system has compatible concerns and supports the decision of the endoscopist to resect. To instigate the CADU, the endoscopist simply presses on a pedal next to his feet, and then a display appears on the right on a per image level telling us if there's dysplasia or not. So looking here at the Barrett segment, you can see an area of nodularity with abnormal pit pattern, abnormal vascularity, which we'll focus on in a second with the freeze frame. But it's these abnormal architecture and patterns that are used to train an AI system using thousands of images from hundreds of different patients to tell and train the neural network to make an accurate prediction of early cancer. And similarly, the AI system is trained with thousands of images of normal Barrett's, but most importantly, as you can see here, is trained with thousands of images of subtle lesions and subtle areas, which are the lesions or areas which are often missed. So let's make a prediction in a second by pressing the pedal on a per image level and looking at an overview of the whole Barrett segment. It's telling us it's dysplastic. Let's look again, give it the best chance by washing the Barrett's mucosa very clearly to give clear views, and let's make another prediction and telling us this is a dysplastic Barrett segment of concern. Let's focus on an area of abnormal tissue here and make another prediction, and it tells us it's dysplastic. And let's look at the left nodular wall here and make another prediction, which tells us it's dysplasia. Let's look at some normal tissue at the GOJ, which has normal architecture, and make a prediction and tells us this is non-dysplastic, and therefore it's making an important differentiation between dysplasia and no dysplasia and able to detect the difference. And similarly here in retroflexion, and make a prediction it's non-dysplastic, but when we focus in and look at the nodularity of the GOJ which comes into view and make a prediction now, clicking the pedal, it tells us that it's dysplastic. And able to differentiate between the two. And in further versions of the CADU, it's able to make targeted biopsy predictions now and also delineations, which we'll show in due course. And making prediction in the stomach here does not fire a false positive when looking at the mucosal folds. So devices like the CADU are a welcome introduction to the endoscopy unit to help maximize early detection and also maximize the chances of curative endoscopic therapy. Thank you for listening, and let's move you on to the next case now.